The point is I'm changing the incentive structure.
Yeah.
The hospital loses money when they treat people. Now you tell me, Shereen, if today 6.5% of people are getting hospitalized, what do you think will happen when I change the incentive totally? And I say the hospital loses money when people come to hospital.
Nobody's going to be kept in hospitals. Now let's talk about how you're going about doing this.
I think what we are doing is for our customers, at renewal, when their price goes up and they are suffering on claims, we're advising them to move to narrow networks. All I want to hear in my ears is that the social security problem, yes, this company is at the forefront of solving social security. I know I will not get this credit ever. That's the only credit I want.
That you solve for India's social security problem.
For India's social security problem in a very, very thought through manner. If you want to solve for social security, you will have to solve for hospitals. There's no other way. These are only 4 products I talk about. I don't talk about a 5th. Health, term, child education, pensions. Health insurance and term insurance, 150 crore rupee market. The whole industry should have been doing that.
Yeah.
That was the most important product. So I thought I was the person coming in to solve the biggest issue that our industry had. So why would the regulator have a challenge with me? People have their vested interests because of which they make your situation harder and harder and harder.
What's the aspiration in terms of size, scale, and impact?
I think 4 years is 1 lakh crores of insurance premium. We are planning to start something in pension very, very soon. I say things which I'm okay to have an argument about. I don't say things which I'm not okay to have an argument about.
As a young person who's starting up today, as a young entrepreneur who's looking to start up today, what is it that you would tell them?
It's the same as my children, what I tell my children. I tell them decide. Decide has everything in it. It has commitment, it has direction, it has you have put blinkers on, you're not doing anything else.
In 2008, an encounter with a group of retired army officers led Yashish Dahiya to a stark realization that millions of Indians were investing their life savings without transparency, financial protection, or guaranteed returns. Now, that moment sparked the birth of Policybazaar, a platform designed to bring clarity to India's insurance market. And today, it's grown into a full-stack fintech powerhouse. PB Fintech, which is the parent company of Policybazaar and Paisabazaar. Hello and welcome to Young Turks Reloaded. I'm Shereen Bhan. With an omni-channel presence in over 200 cities, market leadership in term and health insurance, and a growing footprint in the UAE in healthcare delivery, PB Fintech now clocks around 30,000 crore rupees in ARR. The company went public in 2021 and is now PAT positive. Joining me on the show today is the man who's been at the heart of this journey, an IIT, IIM, INSEAD grad, an Army kid and an Ironman athlete who cycled through grit, clarity and conviction to build one of India's most trusted fintech brands, now ready to give shape to his next big dream, making quality healthcare accessible to India's middle class. Yashish Dahiya, Chairman and Group CEO of PB Fintech, many thanks for joining us here on Young Turks Reloaded. It's great to have you on the program again. Yashish, thanks very much for your time today. But, I want to start by talking to you about what I believe is one of the most important aspects of entrepreneurship. And that's endurance. And in many ways, your Ironman journey converges with the need of entrepreneurship, which I again pointed out is resilience, perseverance, and endurance. How much of this do you think comes from the fact that, like me, you're a 4G kid who's had to bounce around every 2 years, packing up, starting afresh?
I think that has a lot to say for it, because you take things for, things that are hard, you take them for granted. Like, many of us stayed away from our dads as we were growing up.
Yeah.
Because they were in field postings and we just thought it was normal.
Yeah.
That, dad would come home for 2 months in a year. And we used to change schools every 2 years. Today, when I talk to my kids, they are not willing to do that. I think many of the things we take for granted as army kids are actually not very normal in the, I would say, the civilian world. But I think that certainly tells you to get along and not make a fuss.
Yeah, it certainly does teach you to just get on with things. And I think there is an inherent sense of discipline. There is an inherent sense of duty as well, which I think you kind of grow up with subconsciously.
Absolutely. Absolutely. You automatically feel the need to do the right things. I'll tell you a small anecdote. I did the half Ironman in Dubai at some point.
Right.
And I've done it many times. But at one point, I got off social media and all that stuff, and I did not post anything. Of course, I did not post anything. I did not even tell my own family that I had completed it. So Shikha, my wife, tells me that one day when we were just talking, that I know you did not complete the Dubai Ironman. You must have got injured and you must have stopped. So, and she said, show me the medal as proof that you have actually completed it. I said, Shikha, do you realize I have never not completed anything I have started. And that's just the way it is.
Well, so let's talk about what you started in 2008. And you were telling me before the show that people's perception is that this is a very easy business to do. But in 2008, and when I look back at that cohort of 2008, there was you, there was Dippy Goyal trying to do Foodie Bay, which then morphed into Zomato. There was the Bansals doing Flipkart. E-commerce and things like that, that was the sexy thing to do. Insurance, this sort of came out from nowhere. Why would you want to bet on a regulated sector? Why would you want to bet on a sector that, for all practical purposes, had the government's imprint all over it? What made you want to do this?
I did not understand regulation as well as I could have. That said, I would have still done it because it's sort of... to me, this whole making sure social security is there for the middle class in India is worth one life at least. So I feel very good that I'm spending my life solving that. So I would run it. But the only person who warned me about it was Sanjeev.
Bikhchandani.
Yeah, Bikhchandani. So when I met him the first time itself, he said, Yashish, do you realize this is a heavily regulated sector?
Yeah.
And regulation will be your biggest challenge. I heard him. I remember those words. I didn't give any weightage to it, any bhav to it. And I, because I did not know what it was. I had come from the UK.
Yeah.
And I was in a regulated sector. And the regulation was very light touch, right? They just said, do what is right for the consumer. That's broadly what the regulation says. They just do what is right for the consumer.
Yeah.
And what we were doing was the absolute right for the consumer. Think about it. Health insurance and term insurance, 150 crore rupee market. The whole industry should have been doing that.
Yeah.
That was the most important product. Today we all agree those are the most important products. The entire industry was not doing them. So I thought I was the person coming in to solve the biggest issue that our industry had. So why would the regulator have a challenge with me? I couldn't fathom that. But the moment you start walking, you realize that you're crossing wires at various stages. And it's a hard thing. And, people have their vested interests because of which they make your situation harder and harder and harder.
I wanted to close your eyes and go back in time and think about that one moment. Perhaps there is one defining moment where all of this business of people telling you you're stupid to have considered doing this, why are you doing this? It's regulated, so on and so forth. It's hard stuff. Is there one defining moment where you felt that this is worth going all in on, and there was almost a validation of your hypothesis?
I don't think that kind of ever happened. I did it because I needed a job. I didn't have a job at that point. And I had to do something. So I was actually looking for a job back in the UK. And at the same time trying to do this. And genuinely, I was not super convinced about this. The real reason it happened was because my colleagues were a little more convinced that me and them should do something together. At that point, a lot of things hadn't fallen into place. I knew there was a big opportunity. Simply because the industry was not in the right direction at that stage. But I wouldn't claim that there was any point when I felt anything changed. And even today, the validation is not there. I don't think anybody says out there that, oh, Yashish has really solved for social security in a big way. People say, he's become rich, the company's doing well, the company's worth 10 billion.
You've created a viable, sustainable, profitable business.
All I want to hear in my ears is that the social security problem, yes, this company is at the forefront of solving social security. The primary purpose of setting up Policybazaar, the primary thing that makes me come to work every day is to make sure that we have 300 million people in our country. We have 30 million people in our country who, like you and me, speak English, live English, they travel abroad, they have credit cards, they are well off. Then there's 300 million who earn between 50,000 rupees to 1.5 lakh rupees a month as a family. Okay? They're not poor. And they don't want to send their children to poor schools. They don't want to send they want to give their children good education.
They want the private infrastructure.
They want the private infrastructure. Right? But the private infrastructure can set them back. The private infrastructure has been designed for the 30 million, not for the 300 million. And that's our problem. And that is what I'm solving for, right? My only hope is at some point in my life, and I know I will not get it. I already know it. I was speaking to Sanjeev the other day. And I said, I know I will not get this credit ever. That's the only credit I want.
That you solve for India's social security problem.
For India's social security problem in a very, very thought-through manner for maybe 30 years. 17 are over, maybe another 20 years. Right? And yes, you got this right.
So here's the interesting part. You're saying you're already assuming that you're never going to get the credit for it, and it's probably
that's the only thing I want.
And that's the only thing you want. And yet you've decided to now pivot to another business which is seen as complex, which is seen as highly regulated, and you're trying to now solve for India's healthcare problem. I mean, who does that?
If you want to solve for social security, you will have to solve for hospitals. There's no other way, right? What is, just look at the Europe, let's look at Europe. Look at the government spending. What is the highest amount of government spending for? It's for healthcare. It's roughly 13-14% of GDP. And they do quite an efficient job from a government standpoint. It's not totally inefficient, right? You need that kind of money to solve for healthcare, right? Now, for this 300 million people, today, this person is earning 50,000 rupees a month. Saving is about 50,000 rupees a year. Right? You're talking about that person buying an insurance policy and going to a hospital where the per night cost is 78,000 rupees. How's that possible? 6.5% of anybody who buys an insurance goes to hospital. That's the actual data in India, 6.5%. They stay in hospital for a little over 3 days. That means for every 100 people, 20 room nights are used. Right? If the room night's going to cost 50,000, how is it possible? Right? The person can't afford it. Because 10,000 has to go for this. So basically, there's a problem. And our problem is multifold. Insurance is also, remember, this 300 million people we are speaking about are a people who have very low trust. And they also, once they are ill, they really want to buy a health insurance policy somehow. Right? So they also are able to try and navigate the system to try and get a policy with some kind of false declarations. That does happen. Let's not walk away from the reality. Right? There is a risk out there. And so how do you solve for both disclosure and cost at the same time? It's impossible to do it without, in some way, having a narrow network of hospitals. See, today there are 14,000 hospitals. If I tell you, Shereen, you can go to any hospital you want to, whenever you feel like. You have a little malaria, you go and sleep in a hospital. That hospital, because it wants to make a little more money, puts you in the ICU for some time. Right? Who can argue with a doctor that, look, you're over-treating, you are over-indexing on various tests? You can't. They're medical professionals. So they're always right.
So how are you going to solve for that?
You're changing the incentives. Today, the incentive is, look, whatever we say, the incentive is, if you do an operation, you make money. Very simple. If I go to a hospital and they look at me and they say, Yashish, you're very good, go back home. They make no money. But if they say, listen, Yashish, you've got a problem in your heart. You've got 75% blockage or 80% blockage. It'd be good if we put a stent through. Right? In fact, you've got this in 3 arteries. We'll do 3 stents, all separately. And I think the hospital makes money. Now, that's the incentive. That's the incentive problem. I'm trying to get to a position where the hospital does not make money by putting the stents.
So how does the hospital make money?
I pay the hospital 10,000 rupees at the beginning of the year. I may not fall sick. That is full profit for the hospital. 10,000 rupees in your in the hospital, and you do not have to make money. I fall sick, I go to the hospital, I suddenly need surgery. When I have the surgery, it costs the hospital.
Yeah.
They don't make money. It actually costs the hospital. Now you tell me, Shereen, if today 6.5% of people are going to hospital, are getting hospitalized and staying in hospital for 3 days on average, what do you think will happen when I change the incentive totally? And I say the hospital loses money when people come to hospital.
Nobody's going to be kept in hospitals.
Do you realize the 6.5 will automatically come down to 4? Do you realize the 20 room nights have suddenly become 8 to 10? Totally affordable. And that is what we're trying to solve. We're not trying to solve to run better hospitals. Please understand, I don't claim I can run better hospitals. It's a very complex thing to do. The point is I'm changing the incentive structure.
Yeah.
The hospital loses money when they treat people.
That's not a small change, Yashish. This is a massive change that you're trying to bring about. And I would imagine
that there's nobody better at doing that than us.
No, that part is a separate story altogether. But I'm saying the idea to get people on board with this, the medical fraternity on board with this, the current corporate hospital infrastructure to kind of see what you're doing. I mean,
No, I'm not trying to get anybody on board.
Yeah.
That's why I'm setting up my own hospitals. And we'll hire our own doctors. And that's why we're leaning a lot towards the army, because retired army officers who have been doctors, we are hiring a lot of those people. And we're hiring young doctors who like this idea. I don't want to go too far on kind of, it's a very noble profession.
Yeah.
But if I ask the NHS in the UK or the army hospitals in India, if I go through the CGHS and I ask for advice on whether me or my children need to be operated upon or not, I get 2 different advices. And I've got it consistently. And the Indian advice is mostly for over-hospitalization and over-treatment and over-operations. And the UK advice is for under. And what we're trying to find is a balance which may be closer to the army hospitals. And by the way, this is only one part of the problem. The second part of the problem was disclosures.
Yeah.
Customers trying to get policies with false disclosures. That is the part Policybazaar has stopped already. And you asked, why us? Because this is a 2-stage problem. If a customer gives you false disclosures, please understand, a chronically ill customer is 5 to 6 times more expensive than a non-chronically ill customer. If a person says, I do not have diabetes, I do not have this, and gets through the system and buys a policy, or says, I don't have a heart condition, but actually has a heart condition, then the insurance mechanics go wrong. Policybazaar is very good at detecting that. And making sure once as an honest customer you buy a policy. But then it's our industry's job to make sure the claims are settled.
Right.
And to settle them, we have to control healthcare, not the cost of healthcare, but actually the incidence of healthcare.
Yeah.
See, if you don't need to be in hospital, can you be treated at home? Okay, so let's take the UK. What is the percentage of people who are in hospital for vector-borne diseases? Less than 1%. For most vector-borne diseases, you don't need to be in hospital. You can be very well taken care of at home.
Yeah.
With rapid response systems that can bring you into hospital, right? In India, almost 35% of the insurance hospitalization is for vector-borne diseases. What's going on?
I get the fact that there could be over-hospitalization, there could be over-testing, over-prescription, and so on and so forth. But you keep bringing up the UK example and the NHS example. But that's also a system that is broken in many ways.
I wish I could run it privately. I wish I could run it privately.
The NHS?
They have different issues. But if it could be run privately, it would be very efficient. But let's not discuss the UK. I'm not trying to solve that problem.
Sure.
I'm trying to solve the problem here.
Yeah.
But the reason I give that example, so why do we, we're both Army, Air Force kids.
Yeah.
Why do our parents have to go to a doctor to take, for any planned surgery, and get their permission to go to hospital?
Yes.
Why do they have to do that? You tell me, why do they have to do that?
Because the government's footing the bill.
Exactly.
Yeah.
So why can't they just walk into any hospital wherever they feel like and just use the hospital as required? The reason you have that gatekeeper is because the gatekeeper is essential to make sure that the costs don't go out of whack.
Yeah.
And there's no misuse.
Yeah.
Why is the number of robotic surgeries going through the roof? Is it only because they are good for consumers? Or is it also because they are more expensive? All I'm trying to say is, listen, we have a problem. A fee-for-service model has a fundamental... And by the way, it will also succeed in India because the 30 million Indians are willing to pay.
Yeah.
But the 300 million cannot pay. That desire to just go to any hospital, use whatever, is unaffordable. That's the reality. So you have to build a narrower network of hospitals where the incidence is controlled, not the cost. I did not say cost.
But I want to understand from you now, let's talk about how you're going about doing this. Yeah. So you are going to be building hospitals yourself, you're going to be buying hospitals as well?
The hospital build is actually not important.
Right.
I could work with infrastructure from anywhere.
Yeah.
And I'm sure as we go forward, we will work with infrastructure built by others. It is just the first step. I think what we are doing is for our customers, at renewal, when their price goes up and they are suffering on claims, we're advising them to move to narrow networks.
Okay.
Because their price will be controlled, and plus, we will stand guarantee that their claim will be settled. But then they don't have the choice to go to any of the 14,000 hospitals. They have to do exactly what the army structure is. There is a gatekeeper. The gatekeeper will advise you where to go. And the narrow network does not need to be just our hospitals. It can be a narrow network of maybe 500 to 1,000 hospitals. If you need to be in hospital, you will be in hospital. If you don't need to be in hospital, you will not be in hospital. And in those hospitals, whatever treatment you require will be if it is required. It won't be because the hospital makes money out of it. That's broadly what we are doing. But the hospital is not the game changer. The game changer is the gatekeeper. We call it gatekeeper. You can call it general practitioner. So you have a general practitioner. So next, if you buy a policy from us, it would come at a lower price. But you would have to speak to a general practitioner for every planned surgery. If you have, or any planned hospitalization, if you have an emergency or a what do they call it, accident or emergency, that time you can go wherever you want. No problem. Data is telling me at least 50% of the consumers will take
move your way.
100%. Zero doubt.
50%?
50% minimum. Because they already are doing it. 1/3 of the policies we sell are narrow network products. Already. And we started only 1 year ago. We started narrow network products. And now narrow network products are increasingly becoming more and more popular.
So now let's come to the point that people are confused about. What is this? Is this philanthropy? Is this your version of corporate social responsibility? What is this? Because your stock price has seen a significant fluctuation and volatility on account of PB Fintech's decision to invest in this business. And perhaps there has been some misunderstanding of the comments that you've made previously to say this is your passion, but this is also your idea of giving back to society. How should we read what this is about?
Hospitals cannot be my passion. Okay? If I was to do something from a passion perspective, I'd probably set up gyms. I'd probably set up...
Is that coming next?
No, nothing. I don't spend money on my passions. In fact, this is the only thing I spend on my passion, which is a watch, which I have to track my, running performance and all with. And I will not spend my company's money on my passions. I'm not that stupid and that dumb, right? What I will do is do the right thing for the company. Whoever I speak to says if insurance and hospitals were to come together, that would be a game changer. Whoever.
Yeah.
But it's very hard to do. Will I get scared of hard? That is all. Today, what is the difference? Insurance company does not want you in hospital. Hospital wants you in hospital. Very clear? There's no difference in this. And that is why when they're settling your claim, the insurance company says you should not have been in hospital. The hospital says no, and you say no, the doctor told me I should be in hospital. Right? Because the doctor's making money from you being in hospital. Insurance company is losing money when you're in hospital. If they were to be one, do we believe that the 20-30% cost saving that is possible? If that is, then why would you not do it? Just because it's hard? Of course, things are meant to be hard.
That was not my question. My question is that the
people are confused.
The interpretation.
Because it's hard.
No, it's not. It's not even about hard. They're trying to understand what is this? Is this going to be like Policybazaar, a profitable venture in the future that you are currently backing and willing to invest in, or is this a philanthropic venture or philanthropic idea or philanthropic enterprise?
It is going to make profit. There is zero doubt there. It is going to be successful. It will take time. it'll be at least 5 years before we start to see any impact of this. Am I going to spend the next 5 years debating with people and convincing them it's a good idea and it's going to make money? Please understand, Policybazaar took 15 years before it started making money.
Yeah.
So for those 15 years, people kept saying, this is a stupid idea, it's losing money, this, that, and the other. I took it in my stride. One day you'll be proven wrong. Right? Now the point is, when that day comes, most of the people who said it will be a stupid idea will not be there to argue with you. They would have disappeared quietly. I always ask people, please be there. Just hold on, right? Like, as I say, just hold on, just be there. When we are there, let's talk. So the easiest answer is, hey, listen what? It's going to be a failure. Let's start with that. That's the easiest. So I say that to cut conversations. But do I actually believe it? Of course not. How will you not make money? Yes, it's hard to do. You may fail in the execution. 100% you can fail in the execution. But the concept itself is not a bad concept. And I think there's universal agreement on that. Why people initially got confused when they heard hospitals, they thought some idiot who has built some online business is now planning to go and compete with the best hospitals in the country. Now that, I have no particular ambition. I have a huge amount of respect for the way hospitals are run today to try and claim I can run them better. No. If I was to build a hospital and try and compete with the best hospitals the way they are run today, I don't think I will be able to win. But please understand, I'm not a better seller of insurance than an agent. They are probably much better than my employees at selling insurance. I changed the incentive structure. And I'll explain what I did. I said, let us sell those products which are useful to the consumer.
Yeah.
Let us not push those products only which make us the most money. And so what the agent, and don't get me wrong, but in typical, the distribution community is very good at is peddling the product where they make the most money. What Policybazaar is very good is at peddling the product where the consumer gets the biggest benefit. We also make money. It's not like we don't make money. We make money because of scale of operations. We make money because if you do good to the consumers, they come on your own. Why does Policybazaar make money? Because customers come to us on their own. The customers do not go to an agent on their own. The agent has to go scouting for customers. You have to understand, I changed the incentive. I did not become a better seller. I changed the incentive so that I was no longer in competition. That's what I'm doing here. I'm changing the incentive structure altogether, so nobody's competing with me.
Yeah, so you're not up against the Max and the Fortises of the world.
How will they compete with me when I start reducing the incidence rate? They don't want to do it. The outpatient is set up to drive people to the inpatient. The outpatient does not make money. It drives people to the inpatient. What is my outpatient doing? Stopping people from coming to the inpatient. Treating them right there. Sending them back home. How do you compete when the other person wants to do the opposite of what you want to do? Right? I did a course in science and humanism at IIT. It was very interesting. They said, we can't win this competition of having more and more and more. This is not a winnable competition because there's not enough resources for these 8 billion people. But what if you started competing the reverse? I can live on less and less and less. That's a viable competition.
Yeah.
And most of the other people will not be able to, but that's what I believe in. I'm competing on doing with less and less and less. And I welcome everybody to join that competition because that's very good for the world, right? So,
are you finding many takers though?
Okay, the people who take it are very happy. Is our is our eventual objective to be happy?
Yeah.
Then yes. So many people are taking it and they are very happy with their life.
But, from a market point of view, where growth and valuation are the objectives, and that is how performance is judged and success is judged.
I don't want to say what's in my heart, and I will not say it. Because
you're holding back.
No, because I know where we are headed, and it's a very good future from a market's perspective. But there's no point saying it, because it'll take time.
Yeah.
And I don't want to live that time saying, I say things. What did I say? We will make 1,000 crores of profit in 27. We'll do that. What am I now saying? We'll do 1 lakh crores of insurance premium in 2030. So I say things. I say things which I'm okay to have an argument about. I don't say things which I'm not okay to have an argument about. There are things I believe, right? Now, but there's no point talking about them today. Of course it'll be a profitable venture. Why would it not be? All I'm doing, okay. What do I get paid today? I get paid 16%. How much do the hospitals get paid? 70% of the same insurance policy which I'm selling.
Yeah.
Why? What is so hard about this maths?
Yeah.
If you knew that when you buy an insurance policy from me, you will be going to my hospital for treatment, and I'm guaranteeing that claim, you're a middle-class person earning 50,000, and you will have no difficulty at claim. It's a walk-in, walk-out.
Yeah.
What is so difficult about believing that it's compared to today, where a large part, there's a serious noise and difficulty that consumers are facing on claims.
Yeah, absolutely.
Right?
The regulators cracking down on it as well. Yeah.
Now listen, this is where I don't want to cross lines. It can't be solved.
You mean in the current structure?
Because one party's incentive is to increase cost. Another party's incentive is to control cost. This party is saying, through regulation, I will control you. We tried it with the stents. What happened?
Yeah.
People started charging for gloves.
Yeah.
Like, come on.
Yeah.
What are we trying to do? We're trying to say we're going to control humans.
Yeah.
You can't put every human being in jail. You can't do that. Humans can't be controlled. They can only be incentivized.
Yeah.
Right?
Yeah.
So we have a broken system. If I have my customers whom I say that, listen, you'll have a walk-in, walk-out experience at hospital, at any claim, right? People should be willing to take that. And all I'm saying is, do not go to hospital for frivolous stuff.
Yeah.
Why do people want to do that? Are they mad? Are they stupid? Do they want to do this kind of fraudulent activity?
In many ways, as you pointed out, they're being pushed to do that.
But even they want to do it. Maybe they don't have an air conditioner at their house. Maybe they want to sleep in the air conditioner. That's not what hospitals are for.
Yeah.
In the UK, they have a big thing going on. Your ambulance is not your taxi. Right? You use it when you require it. Don't call for it just like that. We have to understand we can't overload our healthcare infrastructure unnecessarily. Use it when required. Respect your healthcare infrastructure.
Yeah.
You are paying. Eventually, Shereen, you are paying for it.
I agree.
There's nobody else. You know, right now what we think? I believe you are paying for my healthcare infrastructure and you believe I am paying for your healthcare infrastructure.
Yeah.
That is where the problem is. Right? The day we start believing we are paying for it, because eventually we are, that Yashish, you are paying for your healthcare usage, that day things will change.
So
and that is what we are trying to do.
So the aspiration of addressing or solving for India's social security problem, insurance done, 17 years on, hospitals, a journey that's about to begin. Is there anything else that you believe you want to address?
Let's try to see what is social security. Social security is, in my opinion, 4 things. One is health insurance, the biggest.
Yeah.
The second is pure life insurance, in which we actually have no major skill, except for the fact that we have an intention to work on it. And actually, nobody else in the distribution world actually has an intention to work on it. The other 2, child education.
Yeah.
I don't think we can support for schooling, because that people have to plan for themselves. So that will only happen if government ever, because like in the UK or in Europe, you have government schooling, right? So most people would send their kids to government schools.
Yeah.
That's not a problem we want to solve. But higher education is a growing cost. When I went to the IIT, I actually got paid. When I went to the IIM, my cost was 10,000 rupees per year. This was 1996. Today, I hear is 30-40 lakhs.
Yeah.
Right? So cost is going up very rapidly. I think people need to plan for that. And why I say child education and not mutual funds is because mutual funds are great. But what if the person who's planning for the child expires? And that is why a child plan. Child plan only because it has waiver of premium, which means if anything bad happens, the insurance company pays the premiums for the next 20 years. The insurance company gives on top of that income support. That is why a child plan. Insurance must not be bought for returns. It has to be bought for insurance.
Absolutely.
We have spent our life as a country buying insurance for returns and tax saving. That is not what it is for. Yes, you get tax saving because social security needs to be incentivized, right? But not because, and the last thing, pensions. Again, why do I say insurance for pension? Why do I not say other factors? And I don't want to go into any specific ones. Because insurance is for two people. Pension is for two people. One of them can die. And that may be the earning person. And that is why, again, insurance. Because you buy the product through insurance because you pay that 0.5% or something you lose. Because you take essentially a life cover or a survivor benefit.
Yeah.
Please understand, whether it's mutual funds, whether it's NPS, whether it's PPF, nobody has that.
Yeah.
So insurance is a very unique product, and social security can only be solved through, and these are only 4 products I talk about. I don't talk about a 5th. Health, term, child education, pensions. And that's what keeps me alive. That's what keeps me going to office, right? Other than that, I have made enough money for myself, which I will not spend in my entire life. I won't be able to spend even 5% of it. I can happily, I can't even spend 1% of it, right? Because on the other hand, I'm competing for using less and less. And I have quite a bit, right? So anyway, I've spoken about what I mean by social security.
Yeah.
We'll address all 4 of them. Health is the most complex and the biggest of them. And so that is the one we are probably farthest down the line in trying to solve for.
And when do you start work on the other 2?
Pension, we are planning to start something in pension very, very soon. Both within Policybazaar, with Paisabazaar, and maybe as a standalone portal as well.
Okay.
Focused only on pensions. We recently revived our license from the PFRDA. So I can speak about that. And so hopefully we'll do something on that. Child education is already 35% of our savings product sales. So see, I have a very simple belief. When you do the right thing, you'll be able to speak about it loudly. So you should be able to go on television and speak about why. See, the 4 products I spoke about, you're a very, knowledgeable person. You can't argue with these 4 products, right?
No.
There is no argument. It's that simple. When you do things, and that's what I like to do. They're fundamental things. When you do them, money making will figure out. Money making has to happen, as time goes. You will, of course, make money. You can't do anything for free. But you should be doing the right thing in the first place. And that's why I always thought, why should regulators ever have a problem with us? We should be Do
they still have problems with you?
No, they don't. They don't. But I'm saying, why should regulators?
Yeah.
We are doing exactly. And many times I ask the regulator, we are the prefect in your class.
Really?
Right.
Really? You tell them you're the prefect in the class?
I tell them we are the prefect in your class.
Why are you the prefect in the class?
You show me the other distributors. You get them on your own show and get them to talk about the 4 most important products. You ask them which are the 4 most important products. And after that, you tell me if they are right or we are right. Who has spent 85% of their total marketing budget on term and health? It would be much easier to sell it on motor or the savings products, right? We've not been doing that. Once we get the child education and the pension story in place, we will start doing it there as well. But I think truth has a way of kind of coming about, and I think it will. But it's usually hard to digest because, that's all.
Do people find you hard to digest, Yashish?
I'm a very easy person to get along with. I don't think any of my colleagues would say I'm a hard person to get along with.
How?
I don't think any of my partners would say I'm a hard person to get along with. I'm hard in the sense I'm pushy.
Huh.
A lot of my colleagues tell me we wouldn't get here if you were not so, what do they say? Anxious is the wrong word. But if you were not so, today is the most important day of my life. So much in the moment.
Do you really treat every day as the most important day of your life?
Yeah. So because today is all I have, right? So, and the amount, I always tell my kids that, listen, you don't have to be super smart or anything. My biggest strength is I plan to do 10 things every day and I do 12. They may not be the same. The 10 that I plan to do may not be part of the 12. I may have done 8 of them, but I would have done 4 more every day. And that's my biggest strength. So my colleagues tell me if I did not have this urgency in me, perhaps we as a company may not be where we are.
As a young person who's starting up today, as a young entrepreneur who's looking to start up today, what is it that you would tell them? What is the Yashish Dahiya playbook?
See, I got very lucky, so there's no Yashish Dahiya playbook. But I would say it's the same as my children, what I tell my children. I tell them decide. I said decide is a very important word. I will make one promise to you. If you decide something, it will happen. 100%. Decide has everything in it. It has commitment, it has direction, you have put blinkers on, you're not doing anything else.
Yeah.
So decide is a very big word. I used to tell my kids when they were kids that, listen, decide. And they said, what do you mean? If I decide to become an Olympic champion, I'll become an Olympic champion. I said, 100%, 100%, not 99.9, 100%. But I said, don't take decide lightly. Decide is a word you'll have to live with for the rest of your life. When you decide, also build trust and patience.
Yeah.
Trust that it'll happen and have patience.
So let's end by talking about what the next 15 years, what could perhaps capture the journey that you intend to make over the next 15 years? What's the aspiration in terms of size, scale, and impact?
Size is very hard to think when you think 15 years.
Yeah.
I think 4 years is 1 lakh crores of insurance premium.
Okay.
That puts you at a pretty large scale, right? And I think we'll be growing from then on also. We'll be part of the solution, not part of the problem.
So this 40-50% growth rate, you think is sustainable?
I just said 1 lakh crores premium. Do the math.
Yeah.
Last year we were at 23,000 crores. From that time we have 5 years. So all I'm saying is we are quadrupling in 5 years.
Yeah.
That's pretty average for us, right? I think the real issue I would say is when we do that, we will be the solution, not the problem. So you can be the problem by becoming large because you're causing more and more difficulty for the consumers, for your industry, for the social security in the country. We will be the solution, not the problem. So I think when I look at 15 years, I think we'd be a very, very large player in social security, healthcare, pensions, life insurance, and child education.
Well, Yashish, it's been an absolute pleasure speaking to you. Thanks very much for joining us and giving us an insight into how you're building out a new incentive structure as far as the healthcare business is concerned, the hospital business is concerned. We look forward to hearing much more from you when you're ready to talk about the rest of it as well. But it's been fabulous speaking to you. We wish you the very best of luck. Thanks very much for your time. Well, with that, it is time for us to wrap up this edition of the Young Turks Reloaded podcast. We hope you enjoyed watching this conversation. If you did, then tune in to us next week. Till then, from all of us here on the program, many thanks for watching. We'll see you again next week.